our respected guest, Professor D. Good morning for all the committee, judges, and participants. Welcome to the third guest lecture series from Indonesia Physiological Society, or IAIFI. Allow me to introduce myself. My name is Roman Gunario from University of Indonesia. Today I will be moderating our guest lecture session, which inviting Professor D. Silverthorn with the title of Homeostasis. Okay, so to all the participants, please make sure that you fill the attendance by the link given, by the given link, and feel free to write down your question on the other link. All right, already with us, the participants for this session, the students and lecturers from 5 medical faculties in Indonesia: University of Syiah Kuala, University of Sam Ratulangi, University of Brawijaya, University of Trisakti, and Unika Atma Jaya. Okay, also with us, our judges and members of IAIFI from all regions in Indonesia. Okay, this session is presented by IAIFI. Therefore, I invite the President of the Indonesian Physiological Society, Dr. Ermita Ilyas, I vote to give an opening statement and introduction to our speaker. Okay, Dr. Ermita, the time is yours.
Thank you, Dr. Roman. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good evening, Prof. D. Silverthorn and friends. Good morning, also for students and all other participants. First of all, I would like to give my greatest gratitude to our distinguished guest lecturer this morning, Prof. D. Silverthorn, Ph.D. from University of Dell, Texas, USA, for your great support to our activity. The third IPS guest lecture this morning. The topic homeostasis is a very, very interesting topic because homeostasis is a very basic concept of physiology. To learn physiology, we have to understand this basic concept. And we all are lucky, especially the students who are beginning to learn physiology, since Professor Silverthorn is here with us, even just virtually, ready to explain this concept to all of you. You will see that we can apply this concept in most of the body system that you will learn in all your study about physiology. So please hear the lecture properly. Again, thank you very much, Prof. Silverthorn. Okay, before Prof. Silverthorn present her lecture, firstly, I would like to introduce Prof. Silverthorn to all of us. Please, Olia, yes. We can see in the screen the beautiful lady, Prof. D. U. Silverthorn, Ph.D. She is a professor emerita and distinguished teaching professor of physiology at the Department of Medical Education at Dell Medical School at the University of Texas, Austin. She is a co-director of course, the title Structure and Function. About the teaching history, Prof. Silverthorn teaches physiology in all of these settings, as well as mentoring graduate students on developing teaching skills. Prior to moving to the medical school, Professor Silverthorn taught undergraduate physiology to health profession students for more than 30 years. Award and honors that Professor Silverthorn has, has received numerous teaching awards and honors, including University of Texas Region's Outstanding Teaching Award, the American Physiological Society Arthur C. Guyton Physiology Educator of the Year, President-elect of the American Physiological Society, a past president of the Human Anatomy and Physiology Society. Professor Silverthorn published more than 50 journal articles. She has done many research in physiology, educational assessment, and curriculum theory. Professor Silverthorn textbook, we all know that human physiology, an integrated approach, is currently in its 8th edition. That's all about Professor Silverthorn. I'm sure we will have a very great lecture about a very important concept in physiology from our distinguished lecturer this morning. We all are lucky to have Professor Silverthorn. I hope all the students can use this opportunity to learn about homeostasis from the expert. Once again, thank you very much, Professor D, for your time. Thank you.
Thank you very much. Let me get my screen going. There we go.
I'm sorry, Professor D.
Yes.
May I say something for the question and answer session? The
Yes,
technical
please.
part? Okay, I'm sorry to interrupt.
No
Okay.
problem.
Thank you, Dr. Amita, for the opening statement. And also, I'm sorry, Professor D, to interrupt. It's an honor for us to be with you in this session. Okay, for your information, participants, Professor D, she said that she's in Arizona, so it's already 8 p.m. in there. So we can see her enthusiasm to be with us in the session. And I know that everyone here is as enthusiastic as our guest lecture this morning. Okay, as Dr. Amita said before in the opening statement, that homeostasis is the fundamental, not just in physiology, but also in medicine. So this is something that I think all medical students should understand and master. Okay, after the lecture, I will inform that there will be a question and answer part. For this part, there will be 5 sessions that will be allocated for students from each invited university. In each session, a set of questions will be given by speaker to students. A lecturer from each university will guide the session for their student, and each session will last for 7 minutes. Okay, yes, it's a very short time. So students, please make sure your answer is short and clear. I would like to inform that we have judges in this event that will give award to the best response from each session. So give your best shot. Okay, Professor D, actually in this question and answer part, we can have a little trip around Indonesia. In the first session, like you already mentioned before, University of Kuala, we will travel to the westernmost region of Indonesia facing Indian Ocean in the island of Sumatra. The next, from the west coast, maybe like in US, the west coast, we move to the north coast of Indonesia, University of Sam Ratulangi, at the side of the Pacific Ocean, and then down to the island of Java, University of Brawijaya, and the last 2 is from the capital of Indonesia, from Jakarta. Okay, without further ado, I will like to allow Professor D to start her lecture. Professor D, you might start whenever you're ready. Thank you very much, Professor D.
Thank you very much for inviting me, and good morning to everyone from Texas, where, as you have heard, it is 8 o'clock in the evening. Before I start to talk about our topic today, which is homeostasis, I would like to let you know how I run a talk like this. If we were in person, I would be giving you questions with a response system such as Kahoot. But since we can't be together in person, there are places where I will stop and ask a question, and then I will pause. And what I hope you will do on your own at home is write down what you think the answer to the question is. Yes, you could wait until I tell you, but the best way to learn is to go ahead and find out what it is you actually know and don't know in advance. So as we start this lecture, I would first like to acknowledge two of my colleagues. This is Michael Chirillo on the left, and he is an MD, Ph.D. And many years ago, about 7 years ago, he was my graduate teaching assistant while he was a graduate student at the University of Texas. And at the same time, Predrag Vujovic from Serbia was also with us for 1 year as a Fulbright Fellow. He came to Texas to learn how we teach in an interactive fashion, not simply standing up and lecturing to students. And from some work that Predrag did with his students at University of Belgrade, we have written a manuscript called Teaching Homeostasis Through Pattern Recognition that was recently accepted to the journal Advances in Physiology Education. So it is in production, and you can keep an eye out for it probably about November to be published. And so some of what I'm saying today, you'll be able to see there, but it's also for the professors in the audience. It talks about how to teach homeostasis. So let's look at homeostasis. We will look at 4 different things today. The first part is actually about learning physiology and what we call pattern recognition. Then we will look briefly at the core concepts of physiology. These are also called the big ideas, but really what they are is repeating patterns. Then we will go into the definition of homeostasis and its properties, and then look at physiological reflexes and how they are important for homeostasis. We know from learning science that people have a very limited short-term memory. It's about 5 to 7 pieces of information that you can put in your short-term memory and hold for any short time. And so one of the things we've also learned is that one way to know and keep more pieces there is to chunk or group some of the information together. And by doing that, when you remember the chunk, you remember all of the pieces that go in the chunk. So I'm going to try this with you right now. If I say breakfast, what do you think of? So you might be thinking of what you eat for breakfast. You might be thinking of where you eat breakfast, what time you eat breakfast, who you eat breakfast. So you can see that one word, breakfast, brings up many different ideas. So breakfast then would be a chunk. It's also the way we hope you are keeping your files on your computer, which is you're looking for a file, you don't know instantly where it is, but you go, I know it's in that folder, and you open that folder, and there are more folders, and you keep opening folders until you get down to the littlest piece of information. So this type of pattern recognition is important, and clinical medicine, as it was mentioned earlier. We have done studies, I haven't, but people have done studies on how people do clinical reasoning in medicine, and we know that it has 2 major components. One is analytical reasoning, very important. But the second one, which is more of interest to us today, is what is called experience-based non-analytical reasoning. And what that is means matching a new problem that you encounter to an example or pattern that you have in your memory. In other words, it's pattern recognition. And in clinical medicine, it can be conscious, but it's more often subconscious, where a clinician seeing a patient at the subconscious level is matching signs and symptoms to what they have seen and experienced before. And sometimes in clinical medicine, this is called the clinician's intuition. But in physiology, we try to make this pattern recognition conscious because it becomes a very important way to help remember everything we need to know. And the repeating patterns for physiology are called core concepts. There are patterns that occur over and over, and there are 5 big ones. The first is structure-function relationships, and an example of that we will see shortly is compartmentation, the division of the body into compartments. The second is energy and matter, which is biochemistry in many cases, but we see a lot of it in physiology. Information, so the information not just from DNA, but also the information that is contained by proteins. And then our topic today, homeostasis. And then number 5 is something we don't often teach in physiology, but perhaps we should do more of, and that is evolution. So our focus today then is on homeostasis. Homeostasis was first described back in the middle of the 1800s by a French physician and physiologist, Claude Bernard. And the translation of his essay says, "The constancy of the internal environment is the condition for a free and independent life." So Bernard discussed homeostasis, but he didn't name it. The name homeostasis comes from an American physiologist, Walter B. Cannon. And he was writing around 1920, so just about 100 years ago. And he described this idea of the relatively constant internal environment as homeostasis. Homeo meaning similar, and then stasis in this case means a state of being. Unfortunately, some people, when they see stasis, think about stopping, static, something, stasis of the blood would be stoppage of the blood. And homeostasis is anything but static. So there are actually some people who think we should call this homeodynamics to indicate how everything is always changing slightly. Dr. Cannon also asked, well, what are the variables for the internal environment that are maintained by homeostasis? And he divided them into 3 groups. The first group would be environmental factors that affect the cells, and that's temperature, pH, water balance, or osmolarity, as we would measure it in the body. The second, he called materials for cell needs. In other words, what does the cell need? It needs oxygen, it needs glucose, it needs sodium, it needs calcium. And then his third group was very interesting because remember, this is 100 years ago. Hormones were brand new. This is the 100th anniversary of the start of the use of insulin for treating diabetes. So people were just learning about hormones. But he called them internal secretions having general and continuous effects. And what we know now is that these are the hormones and the cytokines that are the chemical messengers that run throughout the body. So this figure then is a figure showing how important homeostasis is in medicine, because an organism that is in homeostasis can be challenged by either an external change or an internal change and lose homeostasis. And if the organism is able, it will attempt to compensate. And if the compensation succeeds, the organism goes back into a state of homeostasis and is well. But if compensation fails, then we have illness or disease. And this is where that link between homeostasis and medicine comes in. So remembering that the definition for homeostasis is the maintenance of a relatively constant internal environment, we will look at 3 questions. First, what is this internal environment? Second, what does relatively constant mean? And third, how does the body monitor and maintain homeostasis? So here's our first question. What is our internal environment? And this is where that theme of compartmentation comes in. We can think of our body as one giant compartment, in which case the other compartment is our external environment. But the body is an open system, so we are constantly exchanging material between the external environment and the body. But what does that mean to come into the body? What is the internal environment for the body? So this figure then is showing you what the internal environment for the body is. The purple is the extracellular fluid, and you notice that the cells collectively are completely surrounded by the extracellular fluid, so that the extracellular fluid, or ECF, then is the buffer between the cells and the external environment. And everything that is going to reach the cells has to go through the ECF. Another way of showing this is with a box diagram. And I like this one better because you can see there is one exception to the fact that you must cross the ECF to get to the cells. And that is that everything in the body that has come in or leaves has to cross an epithelium, one or more cell layers, which means that it must cross 2 different cell membranes. But generally it's going across, it's not staying there. And so this is why we can say, as the figure on the left, that everything comes in from the external environment and goes first to the extracellular fluid. Because as you can see, it must go through that purple extracellular fluid before it reaches the cells. So the epithelia then are what help regulate homeostasis and what enters and leaves the body. This is another figure showing the body in a different way, a very schematic way. And you can see the brown line around the outside represents the integumentary system, the very thick epithelium that acts primarily as a barrier for substances entering and leaving. And most of the substances that come into the body or leave the body are going to do so through the digestive system, the respiratory system, and the urinary system. But what's interesting in this figure is that notice how they are white. That is because the lumen, or the inside of these systems, is continuous with the external environment, and everything that you see there in white is actually external environment. So we think of our digestive system as being inside our body, but the lumen of our digestive system is really external environment. It's like the hole running through the center of those beads you see in the photograph. This is how, because it's external environment, we can have pathogenic bacteria, such as E. coli, living in our colon without making us sick. But if something happens and we have a ruptured appendix or a knife wound to the colon, and those bacteria actually get into our internal environment, then we're going to be in trouble because we're going to have an infection. So that takes care of what is the internal environment. It is the extracellular fluid. What does it mean to be relatively constant? Each variable for homeostasis then has a set point with an acceptable range within which the variable can change but still be considered normal limits. We have in medicine in America, we talk about WNL, within normal limits. And so what you see on the graph, the x-axis is time, and the y-axis is the value of the variable. And so you see a set point, which is that line that is straight across time, and the acceptable range. And if we take a variable, it may fluctuate or move within that range, but still be in homeostasis. A good clinical example for this is plasma sodium concentration. So when we receive our laboratory values back, it will show normal plasma sodium is 135 to 145 milliequivalents per liter. In that case, you might say the set point is 140 and the acceptable range is plus or minus 5 milliequivalents per liter. Some variables cycle not just at random, but also in a predictable way, particularly with circadian rhythms or daily rhythms. And this graph shows you the variation in body temperature throughout the course of 24 hours, where it is falling in the early morning hours and reaches a peak about 2 hours ago and then starts to fall again. But we also have variables then that can go outside of range. And when that happens, what we have is a disease. So this is a graph of 2 patients, the normal subject in green and a diabetic subject in red. And they have been fasting for 8 hours and are coming in to do a glucose tolerance test. And you can see at time 0, the normal subject has a plasma glucose concentration within the normal range. They drink a load of glucose and their glucose goes up some, but it still stays within that green, the acceptable range. The diabetic subject starts with a higher level of fasting glucose, still within the normal range for this one. But as soon as they drink the glucose, their plasma glucose level goes way up out of range and stays up even after 2 hours after ingesting the glucose. So this is showing you 2 different scenarios. One is normal and the other is the diabetic, or the loss of homeostasis in the diabetic subject. The term relatively constant is something that students often struggle with, and very often students think that homeostasis means equilibrium, and particularly equilibrium between the extracellular fluid and the intracellular fluid. But if we look at it carefully, we find that the ECF and the ICF are what we call in chemical disequilibrium. And we know that because potassium concentrations are much higher inside the cell than out, while sodium concentrations are much higher in the ECF than they are inside the cell. We also have an electrical disequilibrium, so that if we look at the balance of charge, we find that the intracellular fluid has a net negative charge when compared to the extracellular fluid. But the one equilibrium we do find is osmotic equilibrium, because water can freely cross cell membranes. And so if we measure the intracellular and extracellular osmolarity, we find they are the same. And if one changes, the other will change. So these are not at equilibrium, but because they are staying relatively constant, we can say they are in a steady state. And that's what a steady state means, is relatively constant. One concept, another of the core concepts that is closely tied to homeostasis, is mass balance. This figure is showing just a beaker, and with water coming in and water leaving, and to maintain a constant level, the output must equal the input. We can see the same thing in the body, where we have intake coming from the intestines, skins, and lungs, and a little bit through the skin, and then excretion primarily by kidneys, liver, lungs, and skin. And so the balance requires that the intake be matched by the excretion. But we also have to take into account that there is metabolic production of substances, or a substance may be metabolized to a different substance. So to maintain homeostasis, we have to think about this mass balance equation. The body load plus intake minus excretion needs to be matched. So we move to our third question, which is, how does the body monitor and maintain homeostasis? And Walter Cannon had some ideas about this back in 1920. And again, it's remarkable how we know so much more. He had no idea what the mechanisms were, but he had observed these things. The first was that the nervous system plays a role in maintaining homeostasis. The second is that some systems of the body are under what he called tonic control, and we will define that in a second. The third, some systems of the body are under antagonistic control, and we will also look at that. And then fourth, which is, I think, the most remarkable for 1920, he noticed that one chemical signal could have different effects in different tissues. He knew nothing about receptors, but he observed that one chemical signal could have different effects. So we'll look first at tonic control. There is a tendency in physiology to think of things as being on or off. We turn the process on and then it goes off. But many things are always on. And what we do to change the response is we move them up and down. So think about the knob on a radio, where once you have turned it on, you can turn it up or you can turn it down, but it's still always on. Our example from physiology for tonic control is the effect of sympathetic neurons on blood vessel diameter. The sympathetic neurons to the blood vessels are always firing. And we see on the left, we see a firing rate, and we have a middle-sized blood vessel. If we decrease the firing rate, the top figure in blue, you can see the little red lines get farther apart. Those indicate the action potentials. We have less neurotransmitter released, and the vessel dilates. So it becomes larger than it was on the left. If we increase the signaling rate, the bottom box in red, then we get more neurotransmitter and the blood vessel constricts. So this is a case of up-down tonic control, always on, and the effect depends upon how much of the neurotransmitter is being released. Antagonistic control is when signals have opposing effects, and those signals then are said to be antagonist or antagonistic to each other. So an example from the nervous system, also from the cardiovascular system, is very well known. We have two different types of autonomic neurons that end on the heart. One type, the sympathetic neuron, when it fires, heart rate goes up. The second type, the blue parasympathetic neuron, is responsible for slowing the heart rate. So when it fires, at the bottom figure, you can see that the heart rate slows down. So this is antagonistic control that is sending each one has an effect that is opposite to the other. From the endocrine system, we can see antagonistic control in the effect of hormones on glucose metabolism. When blood glucose levels go up, the hormone insulin is released and carries out effects that will decrease the blood glucose. On the other hand, in a fasted state, if blood glucose is going down, the hormone glucagon is released, and it causes the cells to release glucose and bring the blood glucose back up. So these two hormones, insulin and glucagon, are said to be antagonist or antagonistic to each other. And then this is my favorite of Cannon's postulates, which is how a single signal can have different effects in different tissues. He observed it, but had no idea how this could happen. What we know now is that it depends upon the type of receptor for that chemical signal, as well as the intracellular signal pathway in the target cell. So here is an example showing the effects of epinephrine on blood vessel diameter. So epinephrine is the American term for adrenaline. And epinephrine binds to two different types of receptors. You see here, if it binds to an alpha receptor, the top figure, epinephrine plus the alpha receptor causes vasoconstriction. The blood vessel gets smaller. If the same chemical binds to a beta-2 receptor, the bottom figure, then you see that the binding of the beta-2 receptor relaxes the blood vessel muscles and the blood vessel will dilate. So here is how one signal can have two different effects. One of the key points of homeostasis, but of physiology in general, is that many of the processes you will learn as you go through the systems can be thought of in engineering terms as a control system. And this is a very simple diagram of an engineering control system where there is an input signal that goes into a control center, and we call it in physiology the integrating center. And then there is an output signal and a response of some sort. The body has two primary control systems, the nervous system and the endocrine system. And you've seen some examples of those that I just gave you. One of the key points to remember is just because there is a control system, it does not mean that it is involved in homeostasis. And this was one of the challenges that I gave the students in the questions that we will look at later is, here is a process, is this homeostasis or not? So we talk in physiology, a simple way, we talked about pattern recognition. And by learning the basic pattern and then applying everything to it, it simplifies your life. It makes it much easier to recall because you know you can say, what was the stimulus? What was the sensor? What is the input signal? So this table now is going to compare what these different parts of the reflex are for the nervous system and for the endocrine system. So in the nervous system, the sensors are what we call sensory receptors, and these can be somatic sensory, such as touch receptors, or they can be the special senses, such as vision, taste, smell, etc. In the endocrine system, the sensor is usually the endocrine cell itself. And that makes it interesting because if the endocrine cell is the sensor, it doesn't need a second input signal. On the other hand, the nervous system, the sensory receptor is either part of or connected to a sensory neuron. And that sensory neuron then leads into the integrating center for the nervous system, which is the brain and spinal cord, collectively called the central nervous system, or CNS. The endocrine cell is the integrating center as well as the sensor. The output signals for the two different types of pathway for the nervous system, it will be an efferent neuron. And these fall into two broad categories, somatic motor or autonomic. The output for the endocrine system is a hormone. And the targets are somewhat different. The somatic motor neurons have skeletal muscles for their targets. The autonomic neurons control smooth and cardiac muscle, glands, and adipose tissue. And any cell with the receptor can be a target for the endocrine system because hormones are put into the blood and therefore become available to any cell in the body. And then finally, the targets are going to respond. So if it's a muscle, it may contract. If it's a gland, it may secrete. And we can talk about the tissue level response, but we can also talk about the systemic response. What did contraction of that muscle do for the body overall? And the endocrine system will then modify existing proteins or make new proteins. And that leads us to a wide variety of responses. So here's an example of a simple neural reflex. And we always start with the yellow oval. So that is our stimulus. You may know this. This is the clinically used patellar tendon or knee jerk reflex. So you have the patient with their legs sitting on a table with their legs freely swinging. You tap the tendon just below the patella, and that causes it has a stretch receptor that will fire and send a signal through a sensory neuron to the spinal cord, which is the integrating center. And this is at that point in this particular pathway, it branches, and we are most interested in efferent path 1, which is the somatic motor neuron, which ends on the quadriceps muscle, and then the quadriceps contracts and swings the leg out. So that is our reflex. Let's see if I can get my spotlight back. There we go. All right, so thank you. I've now got my spotlight that I can use to indicate. So there's a simple neural reflex. Is this homeostatic? So think about that for a second. Is this a homeostatic reflex? All right, and remember, what is it? Is this homeostasis? Is this the internal environment? So the answer is no, this is not a homeostatic reflex. Remember, only some reflexes are going to be homeostatic. So the reflexes then are going to be important in helping us look at maintaining or restoring homeostasis. So to be a homeostatic reflex, we must meet 2 requirements. There must be a regulated variable. The stimulus is a regulated or monitored variable. And the reflex must have a negative feedback loop that shuts off the reflex when the variable returns to an acceptable range. So you remember we talked about a set point. Here's the set point and a normal range. And so the reflex turns on when the variable goes outside of range, and then it'll turn off to keep it back in range. And so that is the feedback loop. So looking at the regulated variable, it is a variable that is going to be monitored by a sensor. And as long as it stays within the desired range, then nothing happens. But when it moves outside the desired range, the sensor sends information to the integrating center and triggers a reflex so that the output side then does something to help bring the regulated variable back into the normal range. Some sensors are tonically active. That means, remember we talked about tonic control is always on. So that means a tonically active sensor is always monitoring what's going on. And the carotid and aortic baroreceptors that monitor blood pressure are our best example of always on tonically active. They change the response as blood pressure goes up and down. Other sensors only turn on when the variable goes out of range. And the example we use for this is the hypothalamic osmoreceptors that monitor osmolarity. And so when as long as plasma osmolarity stays below 290 milliosmoles, these receptors are quiet. They're not sending any signals. But as soon as the receptor senses that the osmolarity is above 290, it becomes active and sends information to the cells that secrete vasopressin, also known as antidiuretic hormone. The other thing to remember is that not all feedback is negative feedback. So here is a general picture of negative feedback where the stimulus causes a response, and that response decreases the intensity of the stimulus, and that shuts off the loop. So this is our negative feedback here. On the other hand, some pathways, we have a stimulus that gives a response, but the response actually increases the stimulus. And so that then gets more of a response, and we have gone into what we would call a spiral, an out of control spiral. This is a positive feedback loop. And the only way to stop a positive feedback loop is by removing some stimulus by having an outside factor shut it off. If you have studied action potentials, you know that the entry of sodium through the channels is depolarizing the cell, and that's what started it. But a second factor, a second gate, shuts the channels. In physiology, the delivery of a baby is our example, where oxytocin and stretch on the cervix then cause more oxytocin, causes more stress, stretch and contraction, and it is the delivery of the baby that is the outside factor that shuts off the process. So all of the parts of homeostasis in the internal environment really are aimed at keeping the brain functioning. And if we look at these regulated variables that are responsible for the homeostatic reflexes, we can see blood pressure is necessary to keep blood flow to the brain. The brain needs oxygen and the removal of CO2. It needs glucose. We must keep pH and osmolarity and potassium and temperature and calcium all within their normal ranges to keep the brain functioning. So one of the terms that we're talking about regulated variables here, but one thing that students often get confused about is what is a regulated variable and how is that different from a controlled variable? So we will look at the baroreceptor reflex that we've been talking about, where this is the reflex response to blood pressure. So blood pressure is the stimulus. We have baroreceptors, pressure receptors. Sensory neurons go to the brain, and the output is autonomic neurons acting on different targets. This is another figure, a little simpler, showing the same thing, where the change in blood pressure is sent to the brain through the sensory neuron, and then the output side goes to various targets. In this reflex, the regulated variable is the one that is monitored by the sensors. And so the baroreceptors are monitoring blood pressure. That makes blood pressure then the regulated variable. The controlled variables are what happens on the output side of the reflex. So the controlled variables are going to be heart rate, force of cardiac contraction, and vasodilation in the blood vessels. And we know that these are controlled variables and not regulated variables because we do not have any kind of sensor for them. And so we teach our students this sentence to help them remember. In the baroreceptor reflex, the body is regulating blood pressure by controlling heart rate, force of contraction, and vasodilation. So remember that controlled variables are on the output side, and the regulated variable must have a sensor that is monitoring it. So let's review what we've done so far. We've said that homeostasis is the maintenance of a relatively constant internal environment. The nervous and the endocrine systems work together to maintain homeostasis. Homeostatic reflexes must meet two requirements. The stimulus for the reflex is a change in a regulated variable, and there is a negative feedback loop that shuts off the reflex when the variable returns to an acceptable range. Okay, so now it's your turn to play along and see if you can pick out all of these different parts. So we'll try some examples. Here's example 1. You notice we have the color key up here. One of the things that is very helpful is to have consistent color and shape. When you're recognizing patterns, you can actually start to recognize the patterns simply by the color and the shape of the parts in the map. And so the questions you should ask yourself is, in this map that is shown, this reflex pathway, is there a regulated variable? Is there a negative feedback loop? And is this a homeostatic reflex? So take a second and see if you can answer those questions for yourself. Okay, so is there a regulated variable? We know a regulated variable is monitored by a sensor, and our sensor or receptor is the orange, and in this case, it is the pancreatic beta cell. They're in that diamond shape. And so there is a regulated variable because insulin, the output pathway, goes to target tissues, causes increased glucose use and uptake into cells, which removes it from the blood. So the decrease in blood glucose then is our negative feedback system. And you should have gotten that because it's actually labeled. So is this a homeostatic reflex? Yes, it has a regulated variable and a negative feedback loop. And so this is then the blood glucose monitored for the regulated variable, negative feedback loop, endocrine control of blood glucose homeostasis. All right, let's see how you did. We'll try another example. And this one is very similar because it also is the pancreas with insulin decreasing blood glucose. But is there a regulated variable? Is there a negative feedback loop? And is the reflex homeostatic? So take a second and think about that. Okay, let's see how you did. Is there a regulated variable? I don't see a sensor. There is a receptor there, right? The stretch receptor, but it's not being monitored. It just is activated when you eat a meal and it stretches. So there's no regulated variable. and there's no negative feedback. And therefore, this is not a homeostatic reflex. Actually, this is a different kind of reflex that we call a feed-forward reflex or an anticipatory reflex, because what you see here is before the glucose has ever been absorbed from the digestive tract, remember the interior, the lumen of that digestive tract is still external environment. The pancreas is getting the body ready for that glucose to come in so that you will not see huge swings in glucose concentration. Okay, so there are two examples, both with the same integrating center. One is homeostatic, one is not. It is feed forward. So we've seen our simple neural reflex where we have the input signal is a sensory neuron. The integrating center is the CNS, and we have efferent neurons. We have our simple endocrine reflex, where the endocrine cell is also the sensor. And there's one other type that we should mention, which is a neuroendocrine reflex. So this looks like the simple neural reflex, except that rather than having the efferent neuron terminate on a target, it releases its secretion into the bloodstream like a hormone. And so we call these neurohormones and a neuroendocrine reflex. So this is a combination of the two, if you will. Reflexes can be very complicated. We've done some simple ones, and this is the most complicated one that you will see. But we can have multiple integrating centers, one after the other, in series in a reflex. And so this is one you will learn about later. The first integrating center is the hypothalamus, and the output signal is a neurohormone. But that output signal then goes to the second integrating center, which is the anterior pituitary. And the output from the anterior pituitary then is a hormone that goes off into the blood and goes to find its target tissues. And if the target tissue is another endocrine gland out in the periphery, then we have a third integrating center. So here are three integrating centers, one after the other. And the output then from that third integrating center will be a hormone. So this is probably one of the most complicated of the complex reflexes that you will encounter as you study physiology. The other thing to remember is that it is possible for a single integrating center to have multiple inputs. And this is why we call them integrating centers, because it's important for them to be able to evaluate the information coming in and make an appropriate output. So you've seen this before. It's the two examples. Here is our simple endocrine reflex where the pancreas is monitoring blood glucose and releasing insulin. This is our feed-forward reflex, and you notice the two red diamonds. The central nervous system is the first integrating center, and the pancreas is the second. And then the third one on the right is new, and this is two endocrine centers, because when glucose is in the intestine lumen, there are some endocrine cells there that sense it still in the lumen before it's gotten into the body and release a hormone that goes to the pancreas and tells the pancreas to release insulin. So this then would be another feed-forward reflex. So reflexes, learning to map reflexes is a very nice way to simplify learning complex processes and see how the pathways overlap. And so I would encourage you as you do your studies to see if you can fit the parts of a reflex to any scenario that you've encountered. So in summary, before we go to the problem sets, homeostasis is the maintenance of a relatively constant internal environment, which is our extracellular fluid. The nervous and endocrine systems work together to maintain homeostasis, or they try to. Physiological reflexes have all the parts of a control center with an input side, a control center, and an output. But not all reflexes are homeostatic. Homeostatic reflexes must have a regulated variable that is monitored and a negative feedback loop. Complex reflexes can have 2 or even more integrating centers, and a single integrating center can have 2 or more different inputs. So with that, I want you to remember that homeostasis requires integrated function. It's not just the nervous and the endocrine systems, but it's going to be multiple body systems that are going to have to work together to maintain homeostasis. So I think we're ready now to go to the questions and answers for the problem sets. I was asked to send in 5 problem sets, one for each of 5 different institutions, medical schools, and they were all very similar. And you can work along, if you didn't see it, at your school, but see if you can answer along with the students that were assigned the questions. So each of the questions has the same, each of the problem sets has the same 4 questions. First, there is a paragraph of text, and then see if you can match the words in the text to the steps of the reflex: stimulus, sensor, input pathway, output pathway, integrating center. Answer the questions: is there a regulated variable? Is there a negative feedback loop? And is this a homeostatic reflex? So with that, I'm going to turn this over to Dr. Nanda to please work with her students, and I will put the first question up. So here is the first question, and Dr. Nanda, all yours.
Thank you very much, Professor D. We are very delighted to be here tonight, as this is such a prestigious opportunity for our students here at Kuala University to be able to sit here and hear your lecture tonight. So I would like to invite all students from Kuala University to be prepared for the questions that Prof. D already prepared for us. So I will let you to read the questions for 30 seconds. And after 30 seconds, I will invite volunteers from Kuala University students to raise their hands should they happy to answer the questions. Okay, now I will give time of 30 seconds for you all. Okay, for set questions number 1, if you can raise your hand, and then I will invite one of you to answer the question. Okay, see. Can I invite Vanessa Fadia to answer the first questions? If you can unmute yourself and answer the questions, Vanessa Fadia. Vanessa Fadia?
Sorry, Miss. I think Chud Alifia raised her hand.
Oh, okay. Sorry. Chud Alifia Nazifa, if you can answer the first questions, please.
First of all, good evening, Professor D, and good morning to the professors, doctors, and all participants from Indonesia. Thank you, Professor D and Dr. Nanda, for the opportunities. My name is Chud Alifia, and I'm a first-year medical student at Universitas Kuala. we can match the words to the steps of the reflex, such as the environmental temperature and body core temperature will be decreased, and then the thermoreceptor will be activated. This thermoreceptor will send signals to the thermoregulatory center, which makes the hypothalamus as the thermoregulatory centers receive those signals. And then the hypothalamus will activate somatic motor neurons, which makes the skeletal muscle begin unsynchronized contraction, which is shivering. And then the ATP in the muscles will be broken down, which makes it release the heat, and the heat will circulate throughout the body. Thus, it makes the core body temperature increase, and that shows how these steps will match the words of a reflex. Thank you, Professor D and Dr. Nanda, for the opportunities.
Okay, very nice answer. I will give it back to Professor D if you would like to check if the question is right, or would you like to do it later at the end of the question?
Let's do this now so that people can see. So the first reflex step is the stimulus. So the question is, what are the stimuli for this? And the answer was correct. Decreased environmental temperature and decreased core body temperature are the stimuli too. And then is there a sensor? Yes, the thermoreceptors. The input signal then is the signals from the thermoreceptors, and the integrating center is the thermoregulatory centers in the hypothalamus of the brain. Then the output signal is going to be motor neurons, and the target will be skeletal muscle, and the target response at the tissue response is shivering. And in this case, we were even given the intracellular response of what is happening in response to shivering, which is the release of heat from ATP. And then the systemic response is to raise the core body temperature. So now you can find someone to answer the next three questions for me.
All right. Thank you very much, Prof. D. Now for the second questions, again, I would like to invite the students from Kuala University to raise their hands. I think I saw a few people here. Okay, can I invite Vanessa, now Vanessa Fadia, to answer the second question? Please unmute yourself, Vanessa.
Okay, Miss. Thank you, Miss Nanda and Prof. D. So first of all, my name is Vanessa Fadia from Kuala University. So I would like to answer the second question. So my answer is yes, there is a regulated variable based on the statement in the paragraph. So the regulated variable is the core body temperature itself. It is as the variable that the homeostatic reflexes try to maintain or restore the homeostasis. So based on the paragraph, due to the decreased environmental temperature, the homeostatic reflex tried to restore the homeostasis of the body by raising the core body temperature become a normal core body temperature. Thank you, Prof. D and Ms. Nanda. That's all from me.
All right, thank you very much. Now I will return it to Prof. D to respond to the answers.
Yes, that is absolutely correct. And what I have on my next slide is a more detailed diagram of how we might see this, looking at all different aspects of thermoregulation. But you see the change in core body temperature is sensed by central thermoreceptors, that means in the brain. And there are also peripheral thermoreceptors that can monitor the environmental temperature. This information goes into the hypothalamic thermoregulatory system, and you see marked in black there on the right-hand side, the output somatic motor neurons to skeletal muscles, shivering, and then heat production. And yes, it is a homeostatic response because the production of heat then raises the body temperature that had fallen outside of the acceptable range. So very nice job. Thank you.
Thank you, Professor D. Well done, Vanessa. So
okay. I think we have another question. Are we ready for the
For the
next?
third, yes, for the
Yes.
third question.
Yes.
From your questions, we still have another 2 questions for Kuala University.
Oh, okay.
All right, yeah. Unless
Okay.
Vanessa already answered all the
She actually, yes, she answered all 3 of them in her explanation, which is
Oh, well
why,
done.
yeah.
All right. So let's give the other 2 to the other students if they can repeat what Vanessa just said, Professor.
Yes, good.
All right. Okay, for the third questions, I would like to invite volunteers from Kuala University students. If you could raise your hand. Okay, now I would like to invite Muhammad Fadil to answer the third questions. If you could unmute yourself and answer the question.
Thank you, Prof. D and Dr. Nanda, for the opportunity. Good evening. My name is Muhammad Fadil Al-Ghifari. I am the first medical student in Universitas Kuala. The answer number 4 is yes, there is figurable show how the negative feedback should of the reflex, right after the variable turns into the acceptable value. After the response of the reflex completely have been accomplished the acceptable value, the body responds the situation with negative feedback to shoot off the reflex of our body to keep shivering and more producing heat. Thank you, Prof. D and Dr. Nanda, for the opportunity.
Thank you, Fadil. So, Prof. D, how's the answer from Fadil?
That was a very nice answer. Yes.
Okay, so should we carry on to the next question?
Yes.
All right, thank you. Thank you, Fadil. Okay, for last question for Kuala students, this is your last chance to be able to answer to Prof. the questions directly. I would like to invite all students. Okay, Gina, can you please unmute yourself and answer the questions?
Thank you, Prof. D and Dr. Nanda. I appreciate this opportunity. Beforehand, good evening and let me introduce myself. My name is Gina Nashwa, first year medical student from Kuala University. Reflexes are the mechanism whereby the body is able to sense changes and respond appropriately in order to maintain homeostatic. So yes, the reflex above shows how the body increases the body temperature when the environmental temperature decreases with the response of shivering, and to maintain the value that has been achieved with a negative feedback loop to stop the body to increase the body temperature and keep the value homeostatic. Thank you, Prof. D and Dr. Nanda.
Okay, well done, Gina. So I would return this to Prof. D to respond to the answer.
Yes, that was right. Perfect answer. So exactly what has happened. So the response is sending the temperature back up and turns off the reflex because the stimulus was low temperature and now the response has raised the temperature.
All right. Okay, I think Kuala University already had the turn to answer the questions, Prof. D. I would return it back to you. And thank you very much for this opportunity. Thank you.
Thank you for having your students so well prepared. So,
our pleasure. Thank you very much.
All right. So our next question set, now that we've figured out how this works, is Dr. Sylvia, please.
Dr. Sylvia, you still mute your audio.
Sorry about that. Thank you, Professor D. Good evening to you and good morning to everyone. We are extremely grateful for being involved in this guest lecture. Thank you. So without further ado, I would like to invite my students from Faculty of Medicine, Sam Ratulangi University, Stefanus, Michael, Nalendra, Jaya, and Andrew. You may now activate your speaker and camera. So for the first question, I would like to invite Stefanus to try to answer the first question, please. Stefanus, can you hear me?
Still process into panelization, Doctor.
Thank you, Mbak Aulia.
I think Stephanus can also open the mic because I allow him to unmute.
Stephanus, you may now activate your speaker, please. Okay.
Thank you, Doctor.
And answer right away.
Is my voice, can you hear my voice?
Yes.
Yes,
Probably
activate your video too, your camera. Turn on your camera. Please, Stephanus.
Sorry, Doctor, probably the first question should be answered by Michael instead. I would like to answer.
I can hear you now.
I'm sorry,
you can try to go on.
The first question probably should be answered by Michael, Doctor.
Okay, please, Michael.
Okay, thank you, Doctor, and hello, Professor. My name is Michael. I'm from University of Sam Ratulangi. So let me answer the question. The stimulus, the match the word to the steps of a reflex. The stimulus in the paragraph is sharp object. The sensor is nociceptors or pain receptor. The input signal is sensory neuron. The integrating center is the spinal cord or in the interneuron, and the output signal is the motoric neuron. The target is the right and left leg. In the right leg is the hamstring muscle, and in the left leg is quadriceps muscles. And the cellular or tissue response of the target is the right leg contracts the flexor muscle and motor neuron to the right leg extensor muscle inhibited, so the muscle stay relaxed and will moving the foot away from the sharp object. Also, the motor neuron to the left leg contract the extensors, so the body weight shift to the left. The systemic or body weight response is the right leg quickly lifts from the sharp object and the body weight will shift to the left leg to maintain the body balance. And maybe there are steps that not described, is the hamstring muscle will contract which quickly shift the muscle away called ipsilateral side. Then the sensory neurons speak to another interneuron in the spinal cord and speak to motor neuron on the contralateral or the opposite side and will send its signal out and synapse with quadriceps or the effector, which will contract and plant the left leg to the ground to maintain the body balance. That's all from me. Thank you for it, Professor and Doctor.
Thank you, Michael. So I return to Professor D for your feedback, please.
Yes, you are absolutely correct. The stimulus is stepping on the sharp object, and the receptors are the nociceptors, and the sensory neuron signals to the spinal cord, which is the integrating center. And then the output is indeed the motor neurons to left and right leg. And then the muscles, and you knew more of the muscles than I put in the paragraph, which was excellent. And the muscles will contract, and the response is lifting the right leg away and also shifting the body weight to the left. So very nice job. All right, question 2.
Thank you, Professor D, for your response. So the second question, I would like to invite Stephanus to answer this question, please.
Okay. Thank you, Doctor, and good evening, Professor D. I'm going to try to answer the second question. So in this case, or in this paragraph from observation, yes, there is a monitored variable, and when the right foot steps on a sharp object, the related leg will reflexively be lifted, moving away from the sharp object. And after lifting, the body weights will be shifted, and there goes the input signals, and that will reflexively make the other leg as an anchor. Therefore, the whole body won't collapse or fall down, or as I prefer to call it, the body weight balance. So from my observation, the monitored variable is body balance. Thank you very much.
So Professor D, what do you think about the answer?
So this is, I wondered if people would say this. So it is important for maintaining balance, but what is our definition of homeostasis is stability of the internal environment. And in this case, what we have is balance, which is the whole body. It is not the internal environment being constant. So this is not considered to be a homeostatic reflex because it does not meet the homeostasis. You could argue, and you did very nicely, that this is important for homeostasis of balance, but balance again does not meet that definition of the internal environment. So I put this in because it would be a difficult question and a tricky one. So this is like many of the neural reflexes, this is a difficult one. Is there a negative feedback loop? That's question 3. So maybe one of your students can answer that.
Yes, Professor D. Thank you very much for your explanation. So for the third question, my student Nalendra will be answer that. Please, Nalendra.
Thank you for the rare opportunity to Dr. Sil and Professor D. I would like to answer question number 3. My name is Nalendra Pasuno. I'm from Sam Ratulangi University. I would like to answer question number 3. So from the lectures given by Professor Silverthorn, we learned that there are 2 types of feedback, positive and negative, where positive feedback loops are characterized by their ability to maintain the direction of a stimulus and can even accelerate its effects. In the other hand, negative feedback loops are characterized by their ability to maintain the direction of a stimulus and can even accelerate its effects. So, answering the question above, yes, there is a negative feedback loop in the reflex described. After our body steps on sharp object stimulus, it activates the nociceptor sensor and this sends information to the control or integrating center. This control center evaluates and programs to make an appropriate responses, which is to move away from sharp object. Based on the answer that was given by Michael and Stephanos in question earlier, there are 2 targets. The right leg that was lifted reflectively to avoid the sharp object, and left side of the leg that contracts the extensor muscle to maintain balance. If there were to be a positive feedback, the right leg might lift, later it will step back on the stimulus, which is not the case for everyone if it's a sharp object. Both of the targets make the same response, which is to move towards a target. This concludes that, yes, there is a negative feedback loop in the reflex. Thank you very much.
Thank you, Nalendra. So Professor D, I return to you.
Okay.
For the feedback. Thank you.
Yes. So I am going to go to our picture here. And in the classic definition of homeostasis, this is not a homeostatic reflex. This is what we would call a protective reflex, because the painful stimulus is telling us that there is something that is about to damage the body or is damaging the body. And so the withdrawal reflex, which is lifting the leg, is to remove the body from that painful stimulus. So this is actually considered, rather than a homeostasis reflex, a protective reflex. But I would agree that it is important. The crossed extensor reflex, which is the shift of the weight to the right leg, is important for body balance. But again, in the classic sense of homeostasis, it is not the internal environment. So you could argue very strongly, and you made a good argument for saying that it is negative feedback and a regulated variable, but what are we trying to keep? What is the normal range? What is the set point for that variable? And what is the acceptable range? So you would have to go through and decide how you would put all of those parts of a homeostatic reflex to it. So this was a difficult one. I wanted to see how well you would explain it. That was a very nice explanation for it. Thank you.
Thank you, Professor D, for the feedback. So for the question number 4, I would like to invite Jaya to answer this question. Please, Jaya.
Thank you for the opportunity. My name is Jaya Pat from University of Sam Ratulangi, and I will try to answer question number 4. Just like what Professor D had mentioned before, this is not a homeostatic reflex because there is no regulated variable and there is no negative feedback loop in the scenario described. Thank you.
Thank you for your answer, Jaya. What about the answer, Professor D?
Yes, that is what I would agree with for this. I think, as I said, you could say body balance, but the question is body balance homeostasis. And I think that most physiologists, at least, would say that balance is not homeostasis because it's not internal environment. It is the whole body in space. And so this would not fit the classic definition of a homeostatic reflex. So thank you very much for those answers.
Thank you very much, Professor D, for your feedback. So the last question will be answered by Andrew. I would like to invite Andrew to answer the last question. Yep, the time is yours.
Sorry, Dr. Sylvia, but it's just 4 questions in this set.
Oh, really?
I think Jaya, did I get that right? Answered it just now.
Okay, so it's just 4 questions for the question set number 2, Professor D?
Yes, no, they have answered all 4 questions.
Thank you very much, Professor, for your explanation. Thank you for the opportunity.
Thank you.
I'll get back to you, Professor D.
Okay, thank you. All right, our third question set is Dr. Nia.
Okay, thank you, Professor. Good evening, Professor, and good morning, everyone. Okay, Brawijaya students, you are allowed to read this question for a few seconds. There are 4 questions, right?
And I am going to give you a warning, which is some of the parts of the reflex are not in the words. You would have to fill those in. They are missing from the paragraph, but they would be in a complete answer to the question.
Okay, thank you, Professor. Okay, for the question number 1, please, Muhammad Naufal Raihan to answer the question.
Okay. Firstly, thank you for the opportunity, Dr. Nia, and for the great lecture from Professor D. My name is Muhammad Naufal Raihan from Faculty of Medicine, Brawijaya University. The stimulus mentioned in the paragraph are the sight of food that has retinal acid sensor, and then the smell of food that has olfactory nerve as the sensor, and then it goes to the cerebral cortex. But there are also 2 other that the paragraph didn't mention, which are the thought of food and the taste of food that has taste bud as its sensor. And then the input signal is the body knowing that the person is about to eat food. And then the integrating center is the neuron in medulla oblongata. The output signal is the activation of the parasympathetic nerve. And then the target are salivary glands and enteric system, such as stomach and intestine. The response are increase in salivary secretion, increase in both gastric and intestine secretion and motility. And I don't think there is a systemic response from the stimulus. That is all from me. And again, thank you for the opportunity.
Okay, thank you, Naufal. Professor D, how is the answer from Naufal?
Yes, very nice answer. The sight and smell of food is the only part of the stimulus that is there. But he also mentioned the taste of food and the thought of food. And he also gave us the sensors would be the eyes, for instance, and the nose and the taste buds. And then the neurons going from those sensory receptors into the integrating center. So the rest of the input pathway is missing from the description, but he gave a very nice, he filled it in very nicely. Then the output signal is the neurons and the targets, as said, salivary glands and stomach. The responses will be secretion, motility, and saliva and stomach acids and digestive enzymes. And correct, there is no systemic response really. This is a prepare the stomach response. So that would be as close as you might come, but there is no true systemic response because these are being secreted to the external environment. Saliva and the lumen of the stomach are both external environment. So there can be no systemic response. Okay, question 2.
Okay, thank you, Prof. Thank you, Nova. For question 2, for Aurelie and Alicia, please answer the question.
Okay, first of all, thank you, Dr. Nia and Prof. D for the opportunity, and thank you, Prof. D, for the amazing lecture. Good evening, Prof. D, and greetings to all participants and panelists. My name is Aurel Annelius Setiawan from Brawijaya University. I would like to try to answer the question given. My answer is no, there is no regulated variable because even though there is a component that can be sensed, specifically sight and smell of food that are sensed by olfactory and optic nerves, there is no component here that can be monitored. That is all for my answer. Thank you for the opportunity.
Thank you, Aurelie. Professor D, how is the answer from Aurelie?
That was an excellent answer. It is correct. There is no regulated variable. Again, we say monitored variable. This is coming from the outside of the body. So the body is just sensing the environment. It's not monitoring anything internally. Question 3.
Okay, for question 3, please Hero Barazani to answer the question. Hero, you here? Hero. Okay, maybe Vincent will answer the question. For number 3. Please.
Excuse me?
Yes.
Unfortunately, Hera hasn't been invited to be the panelist. So can I replace him instead?
Okay, please, Maulana.
Thank you, Doctor. I shall try to answer for number 3. Is there a negative feedback loop from the paragraph itself? Unfortunately, there is not, since after the response is given, the response itself is not going to inhibit the stimulus. Thank you, Doctor.
Thank you, Prof. Please, Professor D, how is the answer from Maulana?
That's an excellent answer about, and a good way to describe a negative feedback loop is that the response inhibits or shuts off the stimulus. And that is exactly correct. There is no negative feedback loop. Question 4.
Thank you. For question number 4, please, Vincent.
Okay, thank you, Dr. Nia, for the opportunity and Professor T for the insightful lecture. My name is Vincent from Brawijaya University, and my answer for number 4 is no. The reflex described is not a homeostatic reflex because, firstly, it does it does not maintain a constant internal environment, rather it regulates the external environment. And secondly, it does not have a regulated variable as mentioned before by my colleagues. And thirdly, it does not have a negative feedback loop. Therefore, it does not meet all the requirements to be defined as a homeostatic reflex. Instead, it presents as a feed-forward reflex to prepare the person to consume and digest. That's all for me. Thank you.
Thank you, Vincent. Professor D, any feedback for the Vincent answer?
Yes, that was an excellent answer. And he was paying attention to my earlier part of the lecture because it is indeed a feed-forward reflex. And so that's nice to recognize. Feed-forward reflexes are important in digestion particularly. So here is a short picture of it with the sight, smell, and taste of food and the thought of food, as mentioned by one of the students. And then the fact that these are preparing the stomach for the food that will come. So very nice job answering. Thank you.
Thank you very much, Prof. That's all from Brawijaya. Thanks for the great lecture, Prof.
Thank you.
Thank you, students.
Okay, question set 4, Dr. Francisca.
Okay, thank you, Prof. D. First of all, on behalf of Faculty of Medicine, Universitas Trisakti, I would like to say thank you for this opportunity. It's such an honor for us to attend this lecture and having discussion with you, Prof. And without further ado, please kindly allow me to start this session. Okay, fellow students, here are the questions from Prof. D. You will have approximately 30 seconds to read the questions. And if I call your name, please unmute yourself and answer the question immediately. Okay, time's up. Now we're going to start with the first question. The first one will be answered by Ayesa.
So good evening to you, Professor D, and good morning, distinguished professors, doctors, and everyone here in Indonesia. So my name is Ayesha, and I'm currently in my 7th and last semester here in Trisakti University. First of all, I would like to say thank you very much, Professor D, for the amazing and very informative lecture you gave us this morning. Okay, so for number 1, after reading the paragraph, I'm going to match the words to the steps of the reflex. So for the stimulus itself, it is the decrease on the concentration of calcium in the blood. And then for the sensors is the chief cells of the parathyroid gland. For the input signal, I didn't see it on the paragraph, but I do think it's the second messenger from the chief cells. Probably, if I'm not mistaken, it's the G protein couple receptors. And then for the integrating center, it will be the parathyroid gland itself. For the output signals, it's actually the PTH or the parathyroid hormones. And for the target, it will be the kidney and the bone. And for the response that it would be given, which is the increasing the rate of calcium reabsorption in the kidneys, and it causes the breakdown of the bone matrix into calcium and phosphate ions, which later on, for the systemic body-wide response, it would be the rate of concentration in the concentration of calcium in the blood itself. So that would be all for my answer. Thank you very much for this opportunity, Professor and Doctor.
Okay, thank you, Ayesa, for your explanation. Now we're going to hear some confirmation and comment from Prof. D. Prof. D, the time is yours.
Yes, very nicely done. The stimulus, the decrease in calcium sensed by the chief cells in the parathyroid gland. And the question about the input signal, we absolutely would say that between the receptor of the calcium sensing receptor on the chief cells and the response, there will be intracellular second messenger pathways. So that was nice, not in the paragraph. Thank you for adding that. So the chief cells then are acting both as the integrating center and as the sensor. They release parathyroid hormone for the output, and the targets are kidney and bone matrix. And the result is calcium at the tissues, calcium reabsorption at the kidney, breakdown of bone, and then the systemic response is increasing the concentration of calcium in the blood. So very nice. Question 2.
Okay, thank you, Prof. D, for the explanation. Now we'll proceed with question number 2. Dimas, please kindly share your answer with us.
First of all, thank you, Dr. Francisca and Prof. D, for the opportunity for me to answer the question. First of all, my name is Dimas Jordi. I'm from Trisakti University, and the answer is I think there is a regulated variable which control and regulate by the case, which is the variable that is regulate and control in this case is the concentration of blood calcium. When the plasma calcium concentration falls below a certain level, I think it make the inhibition case and the parathyroid cell secrete the PTA. Thank you, doctor.
Okay, thank you, Dimas, for the answer. Now we'll listen to the further explanation from Prof. D.
Yes, that was absolutely correct. The regulated variable is the concentration of blood in the of calcium in the blood. So question 3.
Okay, for the third question will be answered by Shanas.
Okay, thank you, Dr. Francisca. Good evening for you, Professor G and guests, and good morning for committee participants from Indonesia. I'm Shanas from Trisakti University. Thank you for the opportunity, and I will try to answer this question number 3. As what has been said earlier, yes, there is, because there's a response. So there's a negative feedback loop. The increase of blood calcium concentration in a negative feedback loop, the response should counteract the stimulus and shutting off the response loop. And referring to this case, it's most likely the response is giving a negative feedback towards the stimulus, so the process will gradually become lower, and the calcium will not continue to rapidly increase when the elevation of blood calcium detected. So instead, the blood calcium will be kept within their normal range, being relatively stable in our body. I think that will be all for my answer. Thank you.
Okay, thank you, Shanas, for the explanation. Prof. D, may I ask for your opinion regarding Shanas' answer?
Yes, that was absolutely correct. Very nice explanation.
Okay, thank you, Prof. D. Last but not least, we're going to question number 4 that will be answered by Salma. Salma, would you please answer the question?
Thank you, Dr. Francisca. Thank you, Professor, for the lecture and the opportunity. Good evening, Professor, and good morning for all the participants from Indonesia. First of all, my name is Nafisa Salma. I'm a medical student from Trisakti University. The answer for this question is yes, this reflex can be considered as a homeostatic reflex, considering that the parathyroid hormone increases blood calcium levels when they drop too low and plays a role in maintaining the blood calcium homeostasis. That's all from me. Thank you for your kind attention, Professor.
Okay, thank you, Salma, for your answer. I'm going to ask Prof. D again for her insight regarding Salma's answer.
Yes, that was absolutely correct. And we will look at the map of it. I even put the negative feedback here. So yes, this is a homeostatic reflex. And here is a simpler map of it where the calcium, the plasma calcium level then is causing the release of parathyroid hormone acting on bone, and this has intestine. We didn't talk about intestine in this paragraph, but increasing reabsorption and raising the calcium, which then is the negative feedback signal. So very nice job.
Okay. Thank you, Prof. D, for your enlightenment. I think this is the end of our session. So thank you, everyone, for your kind attention, and I will refer back to Prof. D. Prof. D, the time is yours. Thank you.
Thank you. And last question set, Dr. Heidi.
Okay, good evening, Prof. Thank you for this opportunity, and thank you, Prof. D. Silverthorn, for observing the answer of our student. My name is Heidi, the lecturer of Atma Jaya Medical Faculty, and there are students who will answer the questions. Also, the participant, you can read the question on the screen carefully for 30 seconds. And please turn on your camera and your microphone. Okay, already. For question number 1, please, Michelle, answer the question, please.
Sorry, Dr. Heidi, it's supposed to be Felicia for number 1.
Okay, sorry. Felicia, please answer the question number 1.
Good evening, Professor D and doctors and all participants from all over Indonesia. My name is Felicia Benedicta Cahyadi. Allow me to answer for question number 1. So first, there will be disturbance in the fluid located in the inner hairs in the inner ears, and this is due to the repeated motion that is present. And this will act as a stimulus since it's a form of change that is happening inside the body. The disturbance or change that is happening will be detected by the receptor in the inner ear and will be transported in the form of impulse through the sensory neuron, and this will act as an input signal. This signal will be then forwarded to the integrated center, which is the medulla oblongata and is located in the brain. And the signal is brought here through one of the cranial nerves, which is called the vestibular cochlear. The integrated center will then release an output signal in the form of impulse through the efferent neuron to the target. In this case, is the muscle of the stomach and abdominal wall. They would respond to the signal by contracting, and this contraction would lead to the reverse in the direction of the food. Thus, this will lead to vomiting. Thank you, Professor D, for the opportunity.
Thank you, Feli. Prof D, any review for the answer?
Yes, that was excellent. The stimulus is the repeated motion causing the internal fluid of the ear to be disturbed. The sensors are in the internal ear and inner ear, and then the input signal will be going action potentials traveling through neurons in the vestibulocochlear nerve, integrating center in the medulla oblongata. Output will then be neurons, and we didn't specify which ones, but the targets then are muscles in the stomach and abdominal wall. The tissue response will be muscle contraction, and then the systemic response will be vomiting. So very nice job. Question 2.
Okay, we go for question number 2. And for question number 2, please answer the question. Michelle, please give the answer.
Thank you, Dr. Heidi, for the opportunity, and thank you, Professor D, for the amazing lecture. My name is Michelle Justin Mauro. I would like to answer question number 2. Yes, there is. The regulated variable is the fluid in the inner ears endolymph. Therefore, if there is disturbance to this fluid, it will act as a stimulus and trigger homeostatic reflexes. The endolymph fluid in the inner ear is kept relatively constant in order to maintain homeostasis. Thank you.
Prof D.
So this is a case where I would say there is a monitored variable, which is the state of the fluid, but it is not regulated because the responses are not doing anything to feed back to change that fluid. So it's a monitored variable, but not a regulated variable. All right.
Thank you.
Question 3.
Okay. Thank you, Prof. Lee. And for question number 3, please, Kellen, answer the question, please.
Thank you, Dr. Heidi. Good evening, Professor. Thank you for the opportunity and the amazing lecture. My name is Kellen, and I will answer question number 3. There is no negative feedback loop in the reflex. The reflex is considered to be a positive feedback loop. Positive feedback is designed as a control system with the purpose of driving or accomplishing a given process. In this case, the signals trigger the contraction of muscles in the stomach and abdominal wall that can cause vomiting. Vomiting doesn't reduce the stimulus, thus it can't be considered as negative feedback that maintains the body's homeostasis. Thank you.
Okay. Prof D, any review for the answer from our student?
Yes, that's absolutely correct. It is not a negative feedback loop because it is not doing anything to influence the stimulus that started the reflex. So question 4.
Okay, we go for the last question, question number 4. And please, Sonia, answer the question, please.
Good evening, Professor, doctors, and participants. I would like to thank for this opportunity. My name is Sonia, and I will now like to answer question number 4. As previously mentioned, homeostatic reflexes refer to reflexes that try to maintain or restore homeostasis, in which this must meet 2 requirements, namely, its stimulus is classified as a change in regulated or monitored variable. Furthermore, the reflex must have a negative feedback loop, in which this shuts the reflex when variables meet balance and acceptable values. From the paragraph, we can identify that the reflex is shown by the action in which contractions in the stomach and abdominal wall causes a reverse in the direction of food movement, which led to the occurrence of vomiting. However, in addition, as mentioned by my peer, vomiting is not considered as a negative feedback. Thus, amplifications in the trigger will cause further reaction to occur, in this case, vomiting. Thus, this reflex is not described as a homeostatic reflex. Thank you.
Okay, Prof. D, any feedback for the answer of our student?
That was a very nice and complete answer, and all of those were good answers. So we will see, yes, there is not really a regulated variable. There's a monitored variable, but it is not regulated by the response. There's no negative feedback, and this is therefore not a homeostatic response. And so here would be our reflex shown in the pattern with the stimulus, the sensors, the input pathway, integrating center, output pathway, and the targets and their responses and the systemic response of vomiting. So very nice job, everybody. I'm very impressed by how well you were able to answer these questions. They were not easy. I did not give you straightforward, easy paragraphs to answer. So you did a very good job of analyzing them and applying the reflex pattern to the paragraphs. So I think at this point now, we will go to questions and answers from the participants, and Dr. Roman, our moderator, will come back, and I am going to stop sharing so I can actually see you, because one of the downsides of presenting is that in this format, I have not been able to see your faces. So I'm going to quit so that I can now see you.
Okay, thank you very much, Professor D, for the amazing lecture and discussion. So we not only learn about physiology, but also how to learn physiology physiologically. Okay, Professor D, before we continue, is it possible for us to have questions from general participants?
Yes, absolutely.
Okay, thank you very much, Professor D. So to all participants, again, please make sure to fill the attendance link or form and write down your question by the given link in the room chat. Okay, we already had some questions. I will read the question. There is one from Erlin Adi Sutopo, Professor D. Okay, I think the question is about the homeostatic reflex. Maybe it can be changed by the viral infection, maybe, and also the difference between the homeostatic reflex in the children and the adults. Is it going to different or not? Maybe that's the question.
So in terms of the virus, many reflexes have the ability to have to be changed. So for instance, hypertension, high blood pressure, is an example where the set point, the normal set point for blood pressure, has been reset to a higher, what we would consider dangerous or abnormal level. And so that we know that there are disease processes such as hypertension where the set point can be altered, and fever in response to an infection is another example where the thermoreceptor set point is actually altered by the disease process. So I think, yes, it would be possible for a virus to disrupt homeostasis. I don't know of any examples exactly. I'm not a pathologist, but I would say that I would imagine it would be very easy for some homeostatic processes to be disrupted.
Okay, thank you very much, Professor D. And also, is there any difference or differences between homeostatic reflex in children and adults?
I am not very good on pediatric medicine, and I know that particularly in small children, it may take some time for the nervous system to develop to the same degree as an adult. So I would imagine that there are some differences, but I suspect that some of the pediatricians who are listening tonight would be able to answer that question better than I can.
Thank you very much, Professor D. And then second question is from Hendra Susanto. I will read the question. Okay, dear Professor D, since homeostasis is the fundamental process within the human body, in line with the growing paradigm of molecular physiology, what is the specific or dominant molecular signaling pathway that plays a pivotal role in the early step homeostasis process? Okay, next is how about the homeostasis process at the genetic regulation level? Okay, maybe more the biomolecular of the homeostatic process.
Yeah, I'm not sure. Let's see. Let me see if I can read this so that I can make sure I get it right. Specific or dominant molecular signaling pathway in the early step homeostatic process. I think that homeostasis is so variable that it is impossible to say that there is a single molecular pathway, because when you think about all of the hormones that are involved in homeostasis, and they each have different signaling pathways. So I don't think you can say that there is any single molecular signaling pathway that is responsible or dominant in homeostasis.
Okay. So in this question, we have to see case by case or process by process like that, Professor D.
Yeah.
Okay, next is, or maybe another example for the positive feedback mechanism by neural, or maybe because you already give the example, the oxytocin during labor, maybe is there any other positive feedback in our body?
I think during when a woman is nursing the baby for lactation, and you have the suckling at the breast, and that stimulus then goes and causes the release of oxytocin, which ejects the milk, which then rewards the baby for sucking, and so they suck more. So I would say that that is also a positive feedback pathway that stops when the baby is finally ready to stop nursing.
May I intercept?
Sure.
And add a little?
Yes, of course.
Good evening, Dee.
Good
How are
evening.
you?
Nice to hear you.
Okay. There's another example. I think the generation of an action potential is also a positive feedback process. And then upon reaching plus 40 millivolts, it will shut off, just like the birth of the baby. Will shut off the positive feedback. Thank you.
Okay, thank you very much, Dr. Minarma.
Yes, that is the other example that we always use, because the depolarization opens one gate of the sodium channel. And so then sodium comes in and it keeps depolarizing. And so what would shut that off is the second, or the inactivation gate of that channel.
Okay, thank you very much. Okay, maybe because of the limited time, okay, unfortunately, we need to end the question and answer session. But don't worry, we will compile all of your unanswered questions, and we will, and maybe with the Professor D, will respond and answer and send to you by email. So don't forget to write down your email so we can give the feedback or the response from your questions. Okay, we move to the next event. Last but not least, again, we want to express our deepest gratitude to you, Professor D. There will be a certificate for guest lecturer that will be given virtually by our head of education team in Indonesian Physiological Society, Professor Dr. Ketut Tirtayasa, IF.
Hello. Aulia, tolong the certificate, please.
Ah, there it is.
Please,
Yeah. Dear Prof. D. Silverthorn, I'm Ketut Tirtayasa. Prof. Ketut Tirtayasa. On behalf of Indonesian Physiological Society.
You make it bigger, Aulia. In the screen, please. Sorry.
Yes, doctor. Wait a second.
Yes, thank you.
Yeah, good, good.
Bigger one.
Okay, dear Prof. D, I, Prof. Ketut Tirtayasa. On behalf of Indonesian Physiological Society, we call it IAIFI, would like to give a certificate of appreciation to you due to your contribution to the field of medical physiology. And also as a gratitude for giving us and our medical student a wonderful lecture today. To Prof. D, please accept this certificate. I hope this pandemic, all of us hope this pandemic would end soon and we can meet each other in person. Thank you.
Thank you very much. I have been very honored to be able to speak, and to speak to so many students and professors in Indonesia today. And the advantage of doing it virtually is I was able to connect to many more people than I could if I was there in person. But in person is always better. So yes, we will hope that this terrible pandemic is over soon and we can get back to seeing each other. Thank you so much for the honor of inviting me to speak.
Thank you. Thank you.
Thank you. Thank you.
For information about more than 800 in the Zoom link.
Wow. Yes, that's a lot.
A lot, yes. And also in the YouTube. Yeah.
Well,
Thanks a lot.
I am happy to answer questions. So if you want to send me questions, I will respond to them for people. So that would be good. And look for, I will, Professor Mita, I will send you when the article that we are publishing in Advances, when it is available, I will let you know so that you can tell people. And it is free. Advances in Physiology Education articles are always free from date of publication. So I will let you know about that.
How about the presentation today? So many people, so many participants waiting for that. Very excellent lecture.
Yeah, well, and the students did a wonderful job. I gave them that one about balance is tricky because you can argue it both ways. You can argue that it is homeostatic, except that classically we reserve homeostasis for internal environment, extracellular fluid. So, but we had an argument among colleagues about if it was homeostasis or not. So the students did a good job with that.
Professor Ermita.
Yes.
Hello. I believe that our activity for serial guest lecture like this today and others too previously and the next lecture, I believe that we can report it in American Physiology, Advanced Physiology Education Journal. So we can make it as a paper, and I believe Professor D very like to edit it for us, I think, for publication.
Yeah. Yes, it can be a meeting. We have a section very short called meeting reports. And yes, you can describe it there.
Okay. Okay, we will prepare that. Thank you.
Permission, Doctor and Professor, maybe Dr. Roman will close this webinar first and then we can chit-chat later.
Oh, okay, thank you. All you have to remind us.
Thank you, Aulia, and pardon me, or the committee. Okay, that's marked the end of our wonderful session this morning or maybe evening in Austin, Texas. The Students Award will be announced by email to the winner and your lecturer from your university. And we hope that this session will be beneficial not only for us in this session and also the participant, but also for our society. Thank you very much, Prof. D. Thank you very much for Prof. Tirta from Udayana, all the judges, Dr. Minarma, Dr. Hardian, Dr. Irfan, and all the Ketua Cabang IAIFI from Aceh, Malang, Manado, and Jakarta, all lecturers and panelists in the session, member of IAIFI, and also especially for you students and participants. Stay healthy, okay, maintain your homeostasis, and see you in the next event. Good morning, good night, Prof. D, and have a nice weekend.
Thank you very much.
Thank you so much, Freddy.
Thank you.
Thank you so much.
Congratulations.
Thank you so much.
Have a nice
Thank you for
rest. Have a nice weekend, Prof.
Bye.